The attending surgeon's scalpel slipped. Blood sprayed across the OR as the patient's femoral artery erupted like a geyser. Monitors screamed. The surgical team froze. "Get trauma down here now!" Dr. Morrison shouted, his hands slick and shaking. That's when the intern, the one they'd been mocking all morning for her unusual questions, stepped forward. Before anyone could stop her, her fingers moved in a blur. She performed a compression technique no one recognized, her movements precise and almost military. The bleeding stopped. Completely. In seconds. The room fell silent except for the steady beep of the heart monitor. Dr. Morrison stared at her hands, then at her face. "Where the hell did you learn that?" Her eyes met his. "I wasn't always an intern, doctor." 6 hours earlier, Dr. Maya Reeves had walked into Metropolitan General Hospital with her white coat crisp and her credentials impeccable. On paper, anyway. Her medical school transcripts were flawless, her recommendations glowed. But there were gaps in her resume that she'd learned not to explain. The morning briefing started at 6:30 sharp. The surgical conference room smelled like burnt coffee and ambition. Maya took a seat near the back, observing the dynamics before inserting herself into them. It was a habit she'd developed in other high-stakes environments. Know the terrain before you move. Dr. Richard Morrison entered like he owned the place. In a sense, he did. 20 years as chief of surgery gave him that kind of gravity. Salt and pepper hair, expensive watch, the confident stride of someone who'd never been told no. He barely glanced at the assembled residents and interns before launching into the day's surgical schedule. "We've got 3 routine procedures this morning," he said, pulling up scans on the large monitor. "Appendectomy, gallbladder removal, and a hernia repair. Peters, you're with me on the appy. Torres, you'll assist Davidson on the cholecystectomy." His eyes finally landed on Maya. "And you must be our new intern, Dr. Reeves, correct?" "Yes, sir." Maya kept her voice neutral, professional. "Fresh out of Northwestern, I see. Well, welcome to the real world. You'll shadow me today. Observe, stay out of the way, and if you're very lucky, you might get to close." A few residents chuckled. Maya nodded, filing away the condescension for later. Dr. Amanda Peters, the senior resident, gave Maya a quick once-over. Her expression suggested she'd already decided Maya wasn't worth worrying about. Competition assessed and dismissed. Jake Torres, a third-year resident with too much gel in his hair and too much swagger in his stance, smirked openly. Morrison continued outlining the procedures, but Maya found herself studying the room instead, the equipment manifest posted on the wall, the outdated crash cart in the corner. The way Morrison favored his right hand when he gestured, suggesting possible tremor issues or old injury. Old habits. "Dr. Reeves, are you paying attention?" Maya's focus snapped back. "Yes, sir. You were discussing the appendectomy approach, traditional McBurney's incision versus laparoscopic." Morrison's eyebrow lifted slightly. "Correct. Any thoughts?" "What's your protocol if you encounter unexpected adhesions near major vessels?" The room went quiet. It wasn't the kind of question an intern typically asked on day 1. Too specific, too tactical. Morrison's expression cooled. "We follow standard surgical protocol, Dr. Reeves. I assume they covered that at Northwestern?" "Of course. I just noticed your emergency vascular kit is a 2019 model. Some of the newer field techniques require different equipment." Jake Torres snorted. "Field techniques? What, like MASH?" A few residents laughed. Maya kept her face neutral, but she felt the familiar weight of being underestimated. "Good. Let them." Morrison waved a dismissive hand. "We practice hospital medicine here, Dr. Reeves, not battlefield triage. I appreciate your enthusiasm, but let's focus on learning our procedures before trying to reinvent them." "Understood, sir." The briefing wrapped up, and the team dispersed to prep. Maya headed to the surgeon's lounge to change into scrubs. She'd just finished tying her surgical cap when Jake's voice carried from across the room. Did she seriously just question Morrison's vascular protocol on day 1? Another resident, whose name Maya hadn't caught, laughed. Maybe she learned it from Grey's Anatomy. Heard they do a lot of dramatic arterial bleeds on that show. Did she even go to med school or just binge medical dramas? Maya focused on adjusting her scrubs, her face impassive. She'd heard worse, much worse, in places where words were the least dangerous thing being thrown. Dr. Peters walked past, close enough to hear Jake's commentary. She didn't defend Maya, just rolled her eyes and kept walking, which somehow felt worse than the open mockery. Maya took a breath, centered herself, and walked toward the OR. The surgery prep was routine. Maya scrubbed in, her technique precise and methodical. Morrison watched her for a moment, nodded approvingly at her form, then turned his attention to the patient chart. David Wu, 34 years old, acute appendicitis, straightforward case. In the OR, Maya took her position in the corner as instructed. The surgical team moved with practiced efficiency. Morrison at the lead, Peters across from him, a scrub nurse managing instruments, an anesthesiologist monitoring vitals. And Maya, invisible, observing. "Scalpel," Morrison said. The procedure began smoothly. Morrison's hands were steady, his commentary running for the benefit of the residents. This was a teaching hospital after all, and he played the role of educator with the same confidence he brought to everything else. "Notice the presentation of the appendix," he narrated. "Inflamed, edematous, but no sign of rupture. We're in good shape." Jake Torres leaned in for a better view, nodding along like he'd seen this 1,000 times. He probably had. Maya watched everything, the monitors, the patient's vitals, the way Morrison's right hand tremored slightly when he wasn't actively cutting, the outdated clamps they were using. "So, DeReeves," Morrison said without looking up, "what's your assessment?" "Standard teaching technique. Put the intern on the spot." "Textbook presentation, sir. Clean removal, minimal complications expected." "Good. Maybe you did learn something at Northwestern after all." More chuckles from the team. Maya said nothing. The surgery continued. The team relaxed into comfortable rhythm, the kind that comes from working together repeatedly. Someone made a joke about the hospital cafeteria. Peters mentioned a conference she was attending next month. The atmosphere turned almost casual. That's when Maya noticed Morrison's hand. The tremor was more pronounced, subtle but there. Fatigue, maybe, or stress. His eyes had the faint redness of someone running on too little sleep. "Dr. Morrison," Maya said quietly, "would you like me to adjust the lighting?" "I'm fine, Dr. Reeves. Focus on learning, not backseat driving." He reached deeper into the surgical field, working around an unexpected band of adhesions near the femoral region. Scar tissue from a previous surgery, perhaps. It required delicate work. His hand tremored, just slightly, just enough. The scalpel slipped. For a fraction of a second, nothing happened. Then the femoral artery opened and David Wu's blood pressure became a fountain. Red sprayed across Morrison's gown, the surgical drape, the floor. The monitors erupted in alarm. The anesthesiologist shouted numbers that were dropping too fast. "Clamp! I need a clamp!" Morrison's voice cracked with panic, his hands suddenly everywhere and nowhere, slick with blood, unable to get purchase on the spurting vessel. Peters lunged for the instrument tray, her own hands shaking. Jake Torres backed up a step, his face pale. The scrub nurse hit the code button, and Maya moved. She didn't ask permission, didn't announce her intentions. She simply stepped forward, her hands already configured in a position none of them recognized, and applied pressure in 3 specific points around the wound. Her fingers found the artery with absolute certainty. The bleeding didn't slow. It stopped. Completely. The alarms continued screaming, but the geyser was gone. Just Maya's hands, steady and sure, holding back death with a technique that looked like nothing they'd ever seen in medical school. The OR went silent, except for the monitors and the sound of Morrison's ragged breathing. He stared at her hands, then at her face. His expression moved through shock, confusion, and something that might have been fear. "Where the hell did you learn that?" Maya met his eyes, her voice calm despite her elevated heart rate, despite the weight of revealing what she'd tried so hard to hide. "I wasn't always an intern, doctor." Morrison remained frozen, his blood-soaked gloves hovering uselessly above the surgical field. His eyes were locked on Maya's hands, on the impossible control she had over an artery that should still be spraying his OR with David Wu's life. Maya's voice cut through the alarm-filled air, sharp and clear. "I need 4 euro proline suture now. Dr. Peters, prep for vascular repair." Peters blinked, her hands halfway to the instrument tray before her brain caught up. "You can't just take over a surgery. You're an intern. You can't just—" Maya's eyes flicked to her, then to the monitor displaying David Wu's dropping blood pressure. "The patient has maybe 90 seconds before hypovolemic shock. Your call." The words landed like a slap. Peters's face flushed, anger and indecision warring across her features. "Do what she says!" Morrison's voice cracked back to life, authority reasserting itself even as his hands remained unsteady. "Now, Peters!" The senior resident moved, her jaw tight. The scrub nurse passed Maya the suture with trembling fingers, clearly uncertain about the breach in protocol, but more afraid of losing the patient. Maya's instructions came in rapid succession, each word precisely chosen, no wasted breath. "Dr. Morrison, I need you on the proximal end. When I release primary pressure, you'll have a 2-second window to clamp. Understand?" Morrison positioned himself, and for the first time since Maya had met him that morning, she saw something other than arrogance in his face. Fear. And beneath it, the sharp intelligence that had probably made him chief of surgery in the first place. "On my mark," Maya said. 3-point compression hold, like securing a breach under fire. "Peters, I need you ready with irrigation. Torres, suction." Jake Torres, who'd been pressed against the far wall, jerked forward. "What the hell is a breach under fire?" Maya didn't answer. Her focus was absolute, her hands steady despite her heart hammering against her ribs. This was the moment, the reveal she'd been trying to avoid for 6 years. But David Wu's life mattered more than her secrets. "Mark." Her fingers shifted with surgical precision. Morrison's clamp snapped into place. Not perfect, but good enough. Blood welled but didn't spray. "Good," Maya said, her voice dropping into the teaching tone she'd once used with field medics half her age, in places whose names she still couldn't say out loud. "Now we repair. Modified baseball stitch, continuous suture, start proximal, work distal, keep tension even. This isn't textbook vascular repair. This is making do with what we have when perfect isn't an option." She guided Morrison's hands through the technique, her own maintaining strategic pressure at key points, her instructions mixed. Standard surgical terminology with phrases that didn't belong in a civilian OR. Combat medicine, battlefield protocols, the language of trauma care when resources were limited and time was your enemy. The artery held. The bleeding slowed, then stopped. David Wu's pressure stabilized, climbing back toward acceptable ranges. The anesthesiologist exhaled audibly. "Pressure's coming up, 90/60, 95/62. Maya allowed herself a small breath. Not relief, not yet, but acknowledgement that the immediate crisis had passed. Morrison pulled back slightly, his eyes never leaving the repair site. Then he looked at Maya, really looked at her, and she saw the question forming before he asked it. "What would you do if we had a tension pneumothorax right now, no chest tube kit available?" It was a test. She recognized it immediately. The kind of rapid-fire assessment she'd faced 100 times before, though usually from commanding officers instead of attending surgeons. 14-gauge needle, second intercostal space, mid-clavicular line, Maya answered without hesitation. Improvise a one-way valve with a glove finger if needed. Secure with tape. Monitor for reaccumulation every 30 seconds until proper chest tube placement is available. The silence in the OR was different now. Not shock. Something heavier. Dr. Peters spoke, her voice barely above a whisper. "That's field medicine, combat medicine." No one responded. The surgery continued, but the atmosphere had shifted. Morrison's hands moved through the remaining steps of closing the appendectomy, but his attention was split. Maya could feel his focus on her, weighing, analyzing, recalculating everything he thought he knew about the quiet intern who'd walked into his OR 6 hours ago. 40 minutes later, David Wu was stable, closed, and on his way to recovery. The surgery had been successful despite the catastrophic complication. In the scrub room, Maya methodically washed the blood from her hands and forearms, the warm water turning pink as it swirled down the drain. She could feel them watching her. Morrison, Peters, Torres, even the scrub nurse who'd assisted. They'd followed her out, forming a semicircle between her and the door. Morrison spoke first. "I think you owe us an explanation, Dr. Reeves." Maya dried her hands slowly, buying herself seconds to choose her words. She'd known this moment would come eventually. She'd just hoped for more time. "I was a Navy combat medic," she said, meeting Morrison's eyes. "Special operations, 6 years, 3 deployments." Jake Torres let out a breath that might have been a laugh or might have been disbelief. "Why didn't you mention this? That's exactly the kind of experience that gets you into competitive residencies." Maya's smile was thin, tired. "Because every time I did mention it during residency applications, I got the same response. Medicine is different in the real world. Combat experience doesn't translate. Field. Protocols aren't proper medicine. I wanted to be judged as a doctor, not as a soldier. Special operations, Morrison repeated, his tone caught between defensive and genuinely curious. What unit? The question Maya had been dreading. The one that always led to more questions, more scrutiny, more reasons for people to see her as a weapon instead of a physician. Before she could answer, the code blue alarm shrieked through the hospital speakers. Code blue, recovery room 3. Code blue, recovery room 3. Maya's body reacted before her mind caught up, adrenaline spiking as she turned toward the door. Then Peter's voice, sharp with recognition and fear. That's Wu's room. That's our patient. They ran. Down the corridor, through double doors, Morrison in the lead with Maya half a step behind. The recovery room was chaos. Nurses clustered around David Wu's bed, one performing chest compressions, another bagging him manually. He just crashed, a nurse reported, her voice high and tight. Pressure dropped to nothing. No response. Maya pushed through to the monitor. The numbers told the story her instincts had already written. His pressure's dropping too fast. There's a secondary bleed, something we missed. Morrison's face went pale. The confidence that had started to return drained away, replaced by the haunted look of a surgeon facing his worst nightmare. A mistake. A patient dying because of something he missed. We need to get him back to the OR. Peter said. Now. But Morrison didn't move, his hands, still faintly tremoring, clenched into fists at his sides. Maya could see the paralysis setting in, the fear overriding training, the weight of the earlier near-disaster crushing his ability to act. Doctor, Maya said quietly, stepping into his line of sight. We need to move. Now. Their eyes met. In that moment, Maya saw something she recognized, the look of someone who'd frozen under fire, who'd felt competence slip away when it was needed most. She'd seen it in soldiers, in junior medics, in herself once, a lifetime ago. The question was whether Morrison could push through it, or whether Maya would have to take command again. And this time, there'd be no ambiguity about what it meant. David Wu's monitor alarm screamed, marking each second they didn't have. David Wu was back on the table within 8 minutes, his vitals spiraling downward with each passing second. The OR team moved with frantic efficiency, but Maya could feel the fracture lines spreading through their coordination. Fear did that. It broke apart even the most practiced teams. Morrison was at the sink, scrubbing in for the second time that day. Maya stood beside him, watching his hands move through the motions. The tremor was worse now, not just fatigue. This was adrenaline, fear, and the weight of a mistake that had nearly killed a patient. Dr. Morrison, Maya said quietly, her voice low enough that only he could hear. Are you... I'm fine. His response was automatic, clipped. I've done this 1,000 times. Maya kept her eyes on his hands. The tremor persisted, visible even through the vigorous scrubbing. With respect, your hands are trembling. That slip earlier wasn't just bad luck. You're compromised. Morrison's jaw clenched, his shoulders going rigid. He turned to face her, water dripping from his forearms, and for a moment, Maya saw past the authority and the 2 decades of experience to the raw fear underneath. I don't need a combat medic telling me how to do surgery, he said, his voice sharp enough to cut. You may have some field experience, Dr. Reeves, but this is a hospital. We have protocols, hierarchies. You don't just step in and take over because you think you know better. Dr. Peters pushed through the OR doors, already gowned. Both of you focus. We have a patient dying in there. Whatever this is, deal with it later. She was right. Maya knew she was right, but she also knew what happened when compromised surgeons operated under pressure. She'd seen it in forward operating bases, watched talented physicians make fatal errors because fear or exhaustion had degraded their judgment. Morrison moved to the table. David Wu's abdomen was already open, the previous incision reopened with brutal efficiency. Blood pooled in the cavity, too much blood, and the source wasn't immediately obvious. Suction, Morrison ordered. His hands entered the surgical field, but Maya could see the hesitation in his movements, the second-guessing that replaced his earlier confidence. He explored the repair site. The femoral artery was intact, the stitches holding. But the bleeding continued, welling up from somewhere deeper. Maya positioned herself where she could see the entire field. Her eyes tracked the blood flow, following it back to its source. There. A small tear, barely visible, on the posterior branch of the superior mesenteric artery. Easy to miss during the first surgery, hidden behind the colon, only becoming apparent now as the patient's blood pressure fluctuated. "Doctor," Maya said, keeping her voice level. "Superior mesenteric artery, posterior branch. There's a small tear we missed." Morrison's hands paused. "That's not possible. I checked the entire vascular tree. I would have seen—" The monitors erupted. David Wu's blood pressure was free-falling, the numbers dropping faster than they could compensate. "BP 60/40, Jake Torres called out, his voice cracking. "He's crashing!" Morrison's hands hovered over the surgical field, frozen in indecision. Maya watched his face cycle through the stages of panic, denial, recognition, paralysis. She'd seen this before, not in a hospital, but in a field hospital outside Kandahar. A lieutenant colonel, brilliant trauma surgeon, 20 years of experience, a mass casualty event, 3 soldiers on tables, and he'd frozen. Just stopped, his hands in the air, his mind unable to process the chaos. Maya had made a choice that day. She'd stepped forward, taken command, saved 3 lives. It had also ended her military career. Insubordination, they'd called it, failure to respect the chain of command. Never mind that the chain of command had been paralyzed with fear. "Dr. Reeves," Peter's voice cut through Maya's memory. "Maya, what do we do?" The room had shifted. Everyone was looking at her now, not Morrison, even the scrub nurse, even the anesthesiologist. They'd seen what happened earlier, seen her stop the bleeding when Morrison couldn't. Authority in an OR wasn't just about rank, it was about competence under pressure. Maya stepped forward, her movement deliberate. "Dr. Morrison, I need you to step back, sir." Morrison's head snapped up, his eyes meeting hers. For a moment, she thought he might refuse. His pride, his position, his entire identity as a surgeon balanced against the reality of a dying patient. "I'm the attending," he said, but his voice lacked conviction. Maya kept her tone firm but respectful. "And I'm trying to keep you from losing a patient. You can report me after. You can have my career if you want it. Right now, I'm asking you to trust me." The monitors screamed. David Wu had seconds, not minutes. Morrison's eyes searched hers and Maya let him see what was there. 6 years of combat medicine, 3 deployments, decisions made in impossible circumstances, the calm that came from having already survived the worst moments medicine could offer. Morrison stepped back. Maya moved into position, her hands entering the surgical field with absolute certainty. "Peters, I need better exposure. Retract the colon laterally. Torres, suction here and here. Keep the field clear." Her instructions came in rapid succession, her mind shifting into the mode she'd sworn she'd left behind. This wasn't careful, methodical civilian surgery. This was hasty trauma protocol, designed for field hospitals with limited resources and unlimited casualties. "This is going to look unorthodox," Maya said, her hands already working. "I'm using a modified damage control approach. Stop the bleeding first, perfect repair second." She improvised with the tools available, using them in ways the surgical team had never seen. A Kelly clamp became a temporary vascular occluder. A Penrose drain served as a tourniquet for smaller vessels. Her suturing technique was fast, efficient, prioritizing function over aesthetics. Jake Torres watched with wide eyes. "Where did you learn to ligate like that?" Maya didn't look up from her work. "Fallujah, Kandahar, places where you don't get second chances, where the difference between a living soldier and a dead one is how fast you can control bleeding with whatever tools you have." Her hands moved with practiced precision, isolating the tear in the mesenteric artery. It was small, but in the right location to cause catastrophic bleeding. She placed a figure-of-8 suture, the technique both surgical and improvisational, pulling the vessel walls together, with exactly the right tension. The bleeding stopped. David Wu's pressure began to climb, slowly at first, then steadier, 65/45, 70/50. The anesthesiologist adjusted fluids, compensating for blood loss, and the numbers continued to improve. Maya allowed herself a breath. "We're stable. Peters, let's close. Standard layered approach. Morrison, you want to take over from here?" She was offering him a way back in, a chance to reclaim some authority, but Morrison shook his head, his expression unreadable. "Finish what you started, Dr. Reeves." Maya nodded and continued. The closure was textbook perfect, each layer sutured with care. No more improvisation, no more battlefield medicine, just clean, precise surgical technique. 40 minutes later, David Wu was stable, truly stable, being wheeled to the ICU under close monitoring. The OR team began the process of cleaning up, the tension slowly draining from the room. That's when the door opened. Dr. Helen Carver stood in the entrance, chief of surgery, flanked by two hospital administrators Maya didn't recognize. Carver's expression was neutral, carefully controlled, but her presence said everything. "Dr. Morrison," Carver said, her voice carrying the weight of institutional authority. "We need to talk, now." Her eyes shifted to Maya. "You too, Dr. Reeves. My office. 1 hour." The team exchanged glances. Peters looked worried. Torres looked confused. Morrison's face had gone carefully blank, the expression of someone preparing for professional consequences. Maya stripped off her gloves, her mind already running through what was coming. Violation of protocol, superseding and attending, unauthorized assumption of surgical authority. The list would be long, and the consequences could range from reprimand to termination. She'd saved David Wu's life, twice. But hospitals, like the military, valued chain of command, and she'd broken it, again. As Carver turned to leave, her footsteps echoing in the corridor, Maya caught Morrison's eye. He held her gaze for a long moment, and she couldn't read what she saw there. Gratitude, resentment, fear for his own career? 1 hour, Carver's voice echoed back. "Don't be late." The door swung closed, leaving the surgical team in heavy silence. Maya headed toward the scrub room, her heart steady despite the storm she knew was coming. She'd made her choice, the same choice she always made: save the patient, deal with the consequences after. She just hoped this time the price wouldn't be quite as high. The walk to Dr. Carver's office felt longer than any patrol Maya had ever walked in hostile territory. At least in combat zones, you knew where the threats were coming from. Hospital politics were harder to navigate, the consequences less visible, but just as career-ending. Morrison walked beside her, silent. His shoulders carried the weight of exhaustion and something else. Shame, maybe, or resignation. Maya couldn't tell which, and she was too focused on her own racing thoughts to analyze his. The chief of surgery's office was on the 4th floor, corner suite with windows overlooking the city. Maya had never been inside. Most interns spent their entire residency without setting foot in administrative territory. That she was here on her first day felt almost prophetic. Dr. Carver sat behind a mahogany desk that probably cost more than Maya's annual salary. The two administrators from earlier flanked her like sentries. Morrison took one of the chairs facing the desk. Maya took the other. The silence stretched for what felt like minutes, but was probably only seconds. Maya kept her breathing steady, her posture straight. If this was the end of her medical career, she'd face it the same way she'd faced every other impossible situation, with dignity. "Dr. Reeves," Carver began, her voice measured and professional. "You violated protocol today. You superseded an attending physician in the OR. That's not how we operate at Metropolitan General." Maya met her eyes. "Yes, ma'am. I take full responsibility." "Helen, wait." Morrison's voice cut in, surprising everyone in the room. "Before you go further, there's context you need to hear." Carver's eyebrow lifted slightly. "Dr. Morrison, I've already reviewed the incident reports." "Then let me add to them." Morrison leaned forward, his hands clasped together to hide the tremor that hadn't quite subsided. "I haven't been sleeping. My daughter has been sick for the past 3 weeks. Specialists, tests, uncertainty. I've been distracted, tired, running on coffee and fear. I made a mistake today that could have killed David Wu." He turned to look at Maya, and she saw something in his expression she hadn't expected, gratitude mixed with humility. "She didn't violate protocol, Helen. She saved my career. More importantly, she saved a patient's life, twice, because I was too compromised to do it myself." Carver's expression softened slightly, but her voice remained firm. "Dr. Morrison, you're a decorated surgeon. 20 years of exemplary service. One bad day doesn't define your career." "And I'm human," Morrison continued. "I froze. She didn't. Whatever consequences come from this, they should fall on me, not her. I should have recognized my own limitations. I should have asked for help. Dr. Reeves did what I couldn't. She put the patient first." Maya felt something shift in her chest. She'd expected Morrison to defend his authority, to use his position to deflect blame. Instead, he was falling on his sword for her. It was the kind of integrity she'd seen in the best officers she'd served under, the ones who understood that leadership meant protecting your people, not your ego. Carver leaned back in her chair, studying both of them. Then she picked up a file from her desk, flipping it open. Dr. Reeves, I pulled your full file after the first incident this morning. Navy Cross for Valor, multiple medical commendations from SOCOM Command. Expert. Marksmanship, advanced tactical training, 6 years of combat deployments. She looked up. Why hide this? This is exactly the kind of experience that would have opened doors. Maya took a breath, choosing her words carefully. Because in 3 previous residency programs, I was either treated like a curiosity or told that real medicine was different. That field experience didn't translate to civilian care. I wanted to prove I belonged as a doctor, not as a former soldier. I wanted to be judged on my medical skills, not my combat record. And you think those experiences don't make you a better doctor? The question landed with unexpected weight. Maya had spent 6 years trying to separate those parts of herself, to wall off the soldier so the physician could emerge clean and untainted. But today had proven what she'd been afraid to acknowledge. I'm starting to realize they're not separate, she said slowly. They're both about saving lives under impossible circumstances, about making decisions when there's no time for perfect answers, about doing whatever it takes to bring someone home alive. Carver nodded, something that might have been approval crossing her face. She closed the file and set it aside. Mr. Wu is awake and stable. His family has been informed. Both of you saved his life today. The words hung in the air. Both of you. Not just Maya, not just Morrison, together. Carver turned to Morrison. Richard, take a week off. Mandatory. Go see your daughter. Sleep. Actually sleep, not that thing you've been doing in your office between surgeries. We need you at your best, and right now, you're not. That's not a punishment. That's me taking care of one of my best surgeons. Morrison nodded, the relief visible in the way his shoulders dropped. Thank you, Helen. Then Carver's attention shifted to Maya, and the intensity of her gaze increased. Dr. Reeves, I'm creating a new position, Trauma Innovation Fellow. You'll split your time between the ER and OR, training our staff in field techniques, developing protocols that bridge combat medicine and civilian care. We have a lot to learn from your experience, and I suspect you have a lot to teach. Maya's mind went blank for a moment, unable to process what she was hearing. Not termination, not reprimand, a promotion, a validation of everything she'd tried to hide. I don't know what to say. Say yes, Carver replied, the faintest hint of a smile touching her lips. This hospital needs doctors who can think beyond textbooks, who can improvise when protocols fail, who understand that medicine isn't always clean and perfect. Sometimes it's messy and desperate, and you need people who've already survived that chaos. Yes, Maya said, the word coming out stronger than she expected. Yes, ma'am, thank you. Carver stood, signaling the meeting's end. Good, we'll work out the details next week. For now, go check on your patient, both of you. Outside the office, Dr. Peters and Jake Torres were waiting, leaning against the wall with the anxious expressions of people expecting bad news. They straightened when Maya and Morrison emerged. Peters stepped forward first, extending her hand. I'm sorry for the dismissiveness this morning, for rolling my eyes at your questions, for not listening when I should have. Maya took her hand, surprised by the firmness of the grip. We all have blind spots. Mine was thinking I had to hide who I was to fit in. Jake cleared his throat, looking younger and less cocky than he had that morning. That compression technique you did, the 3-point hold, can you teach me? Can you teach all of us? Maya smiled, feeling some of the tension of the day finally begin to drain away. On one condition, you stop calling people just anything, just an intern, just a medic, just a nurse. Everyone has something to teach if you're willing to learn. Jake nodded, looking appropriately chastened. Deal. Morrison joined them, his expression lighter than it had been in hours. David Wu is asking to meet you, both of us. His wife wants to thank the doctors who saved his life. They walked together to the ICU, the team dynamics already shifting into something new. Not hierarchy based on years of service or institutional rank, but something more collaborative, more honest. David Wu was awake, pale but alive when they entered his room. His wife sat beside him, holding his hand, and when she saw Maya and Morrison, tears filled her eyes. "The nurses told me what happened," David said, his voice weak but steady. "That there were complications, that you both saved my life." His wife stood, crossing to them. "Thank you, both of you. We have 2 children. You gave them their father back." Maya felt the familiar tightness in her chest, the one that always came when the abstract concept of saving lives became concrete. A father, a husband, a person with a family waiting for him to come home. "You're welcome," she said softly. "Just focus on healing now." Morrison added, "You're in good hands here. We'll be monitoring you closely over the next few days." As they left the room, Morrison paused in the hallway, turning to Maya. "We make a good team, Dr. Reeves." "We do, Dr. Morrison." They walked toward the elevator in comfortable silence. Then Morrison spoke again, his tone more tentative than she'd heard from him all day. "So, about those field techniques, the improvisation, the damage control protocols, I'd like to learn, if you're willing to teach." Maya considered him. The man who'd dismissed her that morning, who'd frozen under pressure, who'd then stood up for her when it mattered most. People were complicated, capable of growth, worth the investment of patience. "I'd like to teach," she said. "But first, tell me about your daughter. How's she doing?" Morrison looked surprised by the personal question, then grateful for the opening. "She's getting better. Finally. The specialists think they've figured out what was causing the seizures. New medication protocol. She smiled at me yesterday for the first time in 2 weeks." "That's good," Maya said. "That's really good. Kids are resilient. She'll get through this." "Thank you for asking." Morrison pressed the elevator button. "And thank you for today, for not letting me kill a patient because I was too proud or too scared to admit I needed help." The elevator doors opened. They stepped inside together, and as the doors closed, Maya felt something she hadn't felt in a long time. The sense of belonging she'd been searching for since leaving the Navy. Not as a soldier pretending to be a doctor, or a doctor hiding her soldier past, but as someone whose experiences, all of them, had value. 6 months later, the Tactical Medical Integration Program at Metropolitan General Hospital had trained over 50 physicians in combat-derived emergency protocols. Dr. Maya Reeves published her first paper on civilian applications of battlefield medicine, co-authored with Dr. Richard Morrison, whose daughter had made a full recovery. David Wu recovered completely and started a foundation supporting veteran healthcare workers transitioning to civilian medicine. He visited the hospital often, bringing his children to meet the doctors who'd saved their father's life. And in teaching hospitals across the country, the story spread. The intern who'd been laughed at in the morning and had revolutionized emergency medicine by evening. The attending who'd had the courage to step back and let someone else lead. The chief of surgery who'd chosen innovation over protocol. Sometimes the best teacher is the one everyone underestimated. Sometimes the best leader is the one who knows when to follow. And sometimes the best medicine happens when you stop trying to separate who you were from who you're becoming, and instead let all those experiences make you whole. Maya Reeves had finally come home. Not to a place, but to herself. And in doing so, she'd helped an entire hospital understand that expertise comes from the most unexpected places, if only you're willing to listen.